Hello? Hello?
I'm here.
Hey, how are you?
I'm good. How are you?
Good morning.
Good
Good
morning.
morning.
Is Rachel on here? I didn't see her. I thought I saw her for a second.
I'm here. Good morning.
I'd like to call this meeting of the Mississippi State Board of Medical Licensure Executive Committee to order. I'd like to welcome everybody to our new headquarters and offices. Some of us some of us are just getting oriented here to the new environment, but it seems very nice. Thank you. Appreciate y'all upgrading our facilities.
It was long overdue.
Thank you. We have several items on our agenda this morning, and the our first order of business, our first order of business, is a request from, Dr. Philip Meredith. Is Dr. Meredith on the Zoom?
Yes, good morning, everyone.
Good morning, Dr. Meredith.
Hi.
Just allow me to introduce everybody. I'm Ken Lippincott, president, and we have Dr. Michelle Owens, our secretary.
Vice President.
Vice President, former chief executive, and Rod Givens, our secretary. So Dr. Meredith, could you tell us the nature of your request and reason for your appearance?
Yes, sir. I'm happy to. And thank you for the opportunity to appear before you, especially by the convenience of Zoom. I have invited with me today to appear two nurse practitioners with whom I collaborate at UMC, and I believe they may be on the call. And if so, I want to give them an opportunity just to say hello to the board and introduce themselves. The first is Tirsani Davis. Tirsani, are you on the call?
Yes, sir. Good morning, everyone. I serve as the Director of Clinical Programs and Strategy at the Center for Telehealth and Emerging Technologies at UMMC.
Thank you, Tirsani. The next person is Carl Mangum. Carl, are you on the call?
Yes, I am. Good morning, everyone. My name is Carl Mangum. I serve as the director of the Psychiatric Mental Health Nurse Practitioner Program, and I practice in the Mississippi Delta.
Great. Thank you both for introducing yourselves to the board. Dr. Lippincott, may I just proceed with a very brief presentation and request?
Yes.
Just to clarify the issues for the board, and we are here happy to answer any questions that you may have, but my presentation is very brief, and that is a request of the full board acting through the executive committee now to approve a permanent waiver that was approved back in March by Dr. Cleveland, and thanks to him for that, on two issues. First of all is the 2080 rule. The waiver there involves my work at UMC, which is, it meets the 2080 part of the rule, but according to Jonathan Dalton, who I talked with back in March, who was extremely helpful in working my way through these issues, and thank you to Mr. Dalton. My work at UMC is by telehealth consultation and does not involve direct face-to-face patient contact. So that's the 2080 waiver request. And then the second part of the request is the 75-mile rule, which, as Carl Mangum just mentioned, his work with the school-based clinics in the Delta falls just outside the 75 miles that the board requires. So that's the issue that we are requesting for our collaborative work at UMC is a permanent approval of the 2080 waiver and the 75-mile waiver.
Excuse me, but it's my understanding that for the purposes of this regulation, the 75-mile rule that is mental health not an exception to that. This is totally for mental health consultations, right?
Yes, sir.
Dr. Delphine, part of that requirement is, so to get to that exception, you have to meet 2080.
So he needs an exception to the 2080 and the 75-mile rule. Okay, I just wanted to clarify that, and thank you for that clarification. Okay.
I didn't hear what the answer was. It was breaking up a little bit. Could you clarify that for us?
So the reason for the 75-mile rule being in there is you have to have the exception to the 2080 to qualify to have the exception to the 75.
Okay.
Okay, so your request is entirely valid and proper. I just wanted to clarify. Could you tell us about the nature of your see, Miss Tirsani, I'm sorry, could you please tell me how to pronounce your name?
It's Tierney. That was correct. Tierney Davis.
Ms. Tierney, could you tell us about the nature of the practice?
Of the work? Yes,
The-
sir. Yes, sir. So we are to a 100% telehealth operation out of the University of Mississippi Medical Center. So the physicians at the Mississippi Medical Center are our collaborators. We do have Dr. Merideth, and we also have Dr. Ladner, who's here, on site in Jackson, who are our collaborators. We see patients who are located at majority of our work, let me say that, is us seeing patients who are located in clinics across Mississippi. We partner with FQHC organizations. We partner with some state agencies that house youth, and our providers we do mostly medication management for them. And so Dr. Meredith serves as more of our child collaborator for that work. So the way that we make sure that we adhere to the regulations as far as, collaboration, oversight, people call it different things, is we do have our quarterly meetings at least with Dr. Meredith. We do that with the full Department of Psychiatry. So Carl is on those calls as well as all of the physicians who are collaborators with us or could potentially be collaborators with us, along with the other nurse practitioners. Additionally, Dr. Meredith makes himself available to our team at any point in time. That is one of the requirements we make of all of our collaborators, is we need to be able to get them on the phone or even on a video visit with the patient if we need to. With that said, it works very well, even though he is remote, because our patients are remote as well. So he wouldn't be in a location where he would have to walk into the room and evaluate a patient with us. He also reviews at least 10% of our charts. Sometimes it may go over the 10%, which is our requirement. But 10% of our charts to make sure we meet our requirement for chart review. But then also anytime there may be a more complicated case where we need a higher level of care or his expertise, he does make himself available, as well as, like I said, our backup collaborators as well.
Okay, and are the nurse practitioner visits with the patients, are they all by telehealth?
100%, yes, sir.
Okay.
And so the reason why we do this is we are meeting a need for those clinics in the rural communities. Many of them have had on-site mental health services before, but if their provider leaves, they have a pool of patients who do not have access. So our model is set up such that we can cover several clinics with one provider, because that clinic is only using us for the time that they need a mental health provider. So it really does meet an actual need in the community.
Okay, thank you, Ms. Davis.
You're welcome.
Mr. Mangum, would you have anything to add to that?
No, it's a very efficient system. I will say that. And thank you for any considerations that you give.
Okay, at this time, I'd entertain any other questions from the committee.
I have a question.
Hello?
Thanks. Dr. Meredith, can you describe the just the breadth and depth of the practice? Is it general mental health? Does it include pediatrics, adolescents? And can you just kind of give us a little bit more of a background? Because you mentioned multiple clinics across the state, and I just wanted to get an idea of exactly what kind of care you're providing.
Well, as Tierney mentioned, I primarily collaborate with the nurse practitioners on child and adolescent psychiatry. That's my primary focus of my work and career. I'm board certified in adult psychiatry and have practiced that as well. I primarily collaborate on the child and adolescent psychiatry cases, although I am fully available and do collaborate with them on some adult cases as they are referred to me by the nurse practitioners.
Thanks. And also with respect to overseeing the prescription or the use of controlled substances, what exactly is your process?
Well, Again, as Tierney said, I'm available to collaborate with the nurse practitioners, and I review their charts that do involve prescriptions of controlled substances, but I don't take any, if you're asking about direct oversight of controlled substance prescriptions, I don't do that except to the extent that it involves the collaborative process. I hope that's responsive to your question.
It is, thank you.
Thank you, Dr. Owens. Dr. Givens, do you have anything?
Nope, no questions from me.
Okay, well, we have a request for these exceptions. At this time, we can entertain a motion.
Move to approve the request for waiver.
We have a motion to approve this request. Do we have a second?
Second.
A motion and a second. All in favor, say aye.
Aye.
Aye. The request is granted. Thank you all.
Thank you so much. Will we hear anything official from the board in terms of in writing about that?
Dr. Cleveland, yes.
Okay. Thank you so much for your time and your gracious granting of these waivers. We appreciate it on behalf of the nurse practitioners and the patients that we serve.
Well,
Thank you so much.
I would just like to say that this is it's a good model, and it fills a definite need. So we're confident that you'll continue to practice safe medicine and psychiatry. Thank you.
Thank you. And again, I'd like to say thank you not only to the board, but also to Dr. Cleveland and Jonathan Dalton and Francis Carrillo. Y'all all made this process very easy and efficient, and we are grateful for that. And are we allowed to sign off now?
Yes.
Okay.
Thank
Thank you very much. Thank you. And thank y'all for all that you do. Bye-bye.
Okay. The second item on our agenda is Dr. Anthony Moretta. He's requesting, his primary practice is in Memphis, and he's requesting an exception to the 20/80 and 75-mile rule. Is Dr. Moretta with us?
Yes, sir. I'm here.
Could you tell us the nature of your request, please?
Yes, sir. I'm currently a pediatrician, but I practice pediatric emergency medicine in Memphis, Tennessee at the Spence and Becky Wilson Children's Hospital. And I've worked with Rachel J. Rowe, who's also a nurse practitioner. We've worked together for 10 years. And I'm currently overseeing her nurse practitioner. She does virtual pediatrics. She does virtual visits as well as in-person visits for her private practice that she has. And I've been overseeing her for the last year in Tennessee. And she would like to expand her practice to Mississippi patients as well. And I would like to continue to oversee her in that practice. But we don't physically practice. I do not physically practice in the state of Mississippi. I am a pediatrician as board certified, but I've been doing pediatric emergency medicine for almost 30 years now. And that's my primary practice. But I oversee her in her urgent care practice. And she would like to expand her practice to include patients from Mississippi.
So are you familiar with the rules and regulations for collaborating with nurse practitioners in Mississippi?
Yes, sir.
You understand it requires 10% or a percentage of chart reviews and quarterly face-to-face or online meetings?
Yes, sir. We do that here in Tennessee as well. I currently oversee 20% of her charts, and we meet monthly to go over, and I'm always available to her if she needs a consultation.
Okay. And is this the only nurse practitioner that you're requesting to collaborate with in Mississippi?
Yes, sir. That is correct.
And I'm sorry, I missed her name. What was her name again?
Rachel J. Rowe.
Is she on the call with us?
Yes, sir.
Yes, sir. I'm here.
Okay, so Ms. J. Rowe, is there anything that you'd like to add to Dr. Moretta's request?
Just to clarify, so my current practice, I live in Collierville, and so I'm just across the state line. And I do currently see quite a few patients from North Mississippi who just drive to my house. My local practice is mostly telemedicine, but also house call, sick visit, house call based, since my background is also pediatric ER. So this would just allow me to be able to do telemedicine. For my patients who are in Mississippi, so they're not required to come to me in Tennessee or come across Tennessee state lines in order to be eligible for virtual visits. So this would just to kind of extend continuity of care to them with me and also provide a little more access for them.
So what percentage of your practice is telehealth, Ms. J. Rowe?
Probably about 50%.
And 50% in person?
And 50% in person, yes. But I do house calls locally, so I don't have a brick and mortar clinic.
So, okay, okay, so so you don't so I guess my question was, where do you see these patients in their homes?
In their homes. Mm-hmm.
Wow.
The old school way.
That's kind of refreshing.
I've been doing it for a couple of years, and my practice was originally intended to be all virtual, but I had a lot of demand for in-person visits, and I didn't have a clinic to operate out of. And so I kind of just figured, well, I can just go to people's houses. And that turned out to be a very popular service item. So kind of just stuck with it. But I don't typically venture down into Mississippi. I try to stay pretty close to home.
Okay, so how long have you been doing this in Tennessee?
Going on 3 years.
Okay, and okay, well, thank you very much. Do we have any questions from the committee, Dr. Owens?
Ms. Jarrett, can you kind of tell us a little bit about your background with respect to, I appreciate what you've already shared with respect to your current practice, but can you tell us a little bit about your background and training, like where you trained, when you completed your training, et cetera? Thank you.
Yeah. So I finished nursing school in 2010 and came to Memphis from UT Martin and worked at Le Bonheur in the pediatric ER. And that's where Dr. Moretta and I actually first met. And I worked there for a few years, went back to school to do my master's at Union at their Germantown campus here and completed that training. Still working in the ER full time. I moved to North Carolina for about a year and a half and worked in Winston-Salem in a large pediatric group there, doing same day sick visits, kind of a sort of an after hours clinic, but it started in the afternoon, like after school got out. So mostly urgent care type stuff there, a little bit of primary care mixed in. Moved back to Memphis as a nurse practitioner, worked again at Le Bonheur for a little while in the ER as a nurse, waiting for my credentialing in Tennessee. And then I went to Baptist to the Children's ER when they opened full time in 2015. In December, I worked there full time for 8 years with Dr. Moretta, had a baby, and then decided that maybe the ER hours were not the most conducive for that. So this was kind of an easy way for me to still do what I really enjoyed and stay in my wheelhouse without having to go so far as to build a practice and manage the overhead and all that was a little overwhelming for me with the baby. And so this turned out to be a perfect middle ground for me.
Thank you. Those are questions.
Thanks, Dr. Owens. So, Dr. Givens, do you have anything?
No, sir, no questions. Thank you.
Okay, so we have a request for these exceptions, and at this time, we can entertain a motion.
Move to approve.
We have a motion to approve this request. Do we have a second?
Second.
We have a motion and a second. All in favor, say aye.
Aye.
The request is approved. So
thank you very, very much. We really appreciate your approving this for us and for making the process, as the previous speaker said, very simple. Thank you.
Yeah, thank you very much.
yeah, you're welcome, and we're confident that you'll continue practicing safe and necessary medicine. So thank you very much.
Absolutely. Thank you.
The next item on our list is Kristina Ray, MD, is requesting an exception to the 2080 and the 75-mile rules. Is Dr. Ray on the call with us? Dr. Ray, good morning.
Yes, good morning.
Good morning.
I'm here.
So it says your primary practice is in Poplarville, Mississippi, but your mailing address is in Mobile, Alabama. Is that right?
Correct. For the purposes of this exception, I am going to be in Poplarville, Mississippi, but my primary residence is actually in Alabama and my business is in Alabama.
So where are you this morning?
I'm in Poplarville.
Okay. Well, good morning. Could you tell us about what is it that you're requesting, Dr. Ray?
Okay, well, thank you. And I'll echo the prior two speakers and appreciate y'all letting us do this Zoom for convenience and ease. But so basically, I'm an internal medicine physician and I practice. Currently, my practice is only for brick and mortar is on site at nursing homes in the Mobile County and Baldwin County area. But I have family in Poplarville and my son is finishing high school here. So I live half the week in Mississippi and half the week in Mobile when I do my practice for nursing homes. I also do hospice coverage, which is sometimes in person and sometimes I do that also via telemedicine. And then I have a telemedicine practice where I see patients in Tennessee, Alabama, Mississippi, Georgia, and Florida. So I was contacted by this company, Open Loop, who was looking for a collaborator for nurse practitioners who will go into patient homes all over the state. And they are basically doing assessments to capture gaps and diagnoses. They are not treating patients. They will not be prescribing any medications, but they needed a physician to oversee documentation and be available in case there was a patient maybe that had a disease process that they were concerned about and they needed assistance. So I interviewed, agreed to do that. And then I asked them to provide me with the rules for Mississippi. And when I saw that, I said, you guys are going to have to put a hold on this because I don't meet these rules. And again, I spoke with Jonathan Dalton and he said I could apply for an exception. So that's what I'm doing.
Okay. Please clarify for me. You're requesting to collaborate with nurse practitioners in Mississippi who will be seeing patients to find gaps in their diagnoses, but they won't be treating. I don't really understand. Can you clarify that for me?
Yes. So there's often insurances for Medicare Advantage and Medicare want to capture all diagnoses that maybe their patient's primary care doctor has not coded in the past year, or they've been to different specialists and they don't see a primary care. And so there are diagnoses that are missed. So the insurance companies will contract out nurse practitioners to go into the home and try and capture all these things. Also, it's for your preventative wellness. They can do, say, a diabetic foot exam in the home. They can get blood pressure screens. They sometimes will take point of care testing. That's not very common. And to my knowledge, Open Loop is not doing that. But to close these gaps for care to show Medicare that they are provided, the patients are having the things done that Medicare wants them to have done. Depression screenings can also be done. Some insurance companies like United do this on their own. They'll send nurse practitioners on their own payroll, but Open Loop is a contracted company, is my understanding from my discussions with them.
What's the name of your company?
For the purposes of this collaboration?
Yeah.
Open Loop.
Open Loop. And do you know any of these nurse practitioners that you're proposing to collaborate with?
No, sir. I do not know any of them personally. We will meet monthly via Zoom or phone call until I get to know them better. And I've reviewed enough of their charts. We are doing 10% of their charts. And there's several that they've asked me to collaborate with. I've asked them to cap it because they keep sending me more. And I've told them I don't really want more than 10. But most of them are doing no more than 1 or 2 patient visits a week because they're all over the state.
Okay. So, but you don't know how many nurse practitioners you'll be asked to collaborate with.
No, I do. I have, and they should all be uploaded on the board. They have sent me a few others requesting that I have not signed as in a contract with an agreement. I stopped at what is currently on the application on the gateway.
Okay. Okay, but if we approve this request, I guess potentially you could collaborate with more. Is that your understanding?
Well, was going to follow up a question with that and ask you what your preference would be if you do approve this request. I can keep it where we are. I'm fine with that. If they request that I do more, I can cap it at a certain number. This is just a side for me while I'm, over here in Mississippi to help out.
Okay, so let me ask you this. Do you know what percentage of these nurse practitioners are conducting in-person visits or telehealth visits?
So for the purposes of this particular collaboration with them, my understanding is it will all be 100% in person. They go to the patient's homes.
Okay. Okay. Well, thank you. We have any other questions from the committee? Dr. Owens or Dr. Gibbons?
And I would just like to clarify one of the questions that came up earlier.
Yeah.
Previously, we've always asked people that if they wanted to add more nurse practitioners to the collaborative agreement, that they come back before the EC again to add more. So I would just say that.
Okay.
And then, and obviously you've looked at the telemedicine or the collaboration regulations, but I would urge you to also look at the hospice regulations that are in there as well.
So quick.
My hospice practice is in Alabama only.
So
Dr. Gibbons.
Yeah, sorry. Yeah, Rod Gibbons. So quick question. So currently, I think you are collaborating with this. Is it 6 NPs? Okay. So so this is in process. So
right. These are all in process. Nothing has been approved. I have put the application on the gateway.
Okay. I got you. Is anything, we would just want to make sure everything's safe, reasonable number,
Absolutely. I agree.
Oversight, all of that. So that's why we're just being specific with
No,
these.
I understand completely.
Any further, you have any questions, Dr. Owens? In order to grant an exception, we need to have evidence of we need to have evidence of a need, and we need to have evidence that it's safe. Not yet. But I'm still not quite clear on the necessity of this service. Could you elaborate on that a little bit for me?
I probably cannot, and I was not able to get anyone from Open Loop as a representative to be available this morning to give you more information. So I apologize for that. I think the need is from, honestly, my understanding is an insurance standpoint, a need for them to completely evaluate a patient.
Okay, well, thank you very much, Dr. Ray. Really appreciate your efforts to comply with the rules. At this time, we can entertain a motion. Dr. Owens?
Move to close the meeting to consider whether to go into executive session on this matter.
We have a motion to close the meeting. Do we have a second?
Second.
We have a motion and a second. All in favor of closing the meeting?
Aye.
Aye. Meeting is closed, and we will retire to the What do you call it, room?
Deliberation.
The deliberation room.
Is anybody available that can go in there? I told them the wrong name. It's Harmony Cares. Open loop with somebody else.
We'll relay the message. Thank you.
I appreciate it. I'm sorry. I had open loop up for something else.
The executive committee is back in open session, and I will ask our secretary, Dr. Givens, to report the decision of the committee.
Yes, sir. Thank you, Dr. Lippincott. With regard to the request by Dr. Kristina Ray regarding the 20, 80, and 75-mile rule exception, the executive committee has elected to table its decision until our next scheduled meeting, pending additional information that will be requested. That's requested by the executive committee, and we ask that you contact Dr. Cleveland regarding that matter next week.
Thank you.
Okay, sure. I attempted to get the clinical director from Harmony Cares and see, but he did not. He wasn't available, I guess. And I sent an email, but they didn't respond back before you have come back. So I'll be happy to do that. Is there contact information for Dr. Cleveland available somewhere?
Yeah, the general number for the medical board is on our website.
Okay, just call you.
Yeah, well, you're not going to get directly to me, but you will eventually.
Yeah, that's what I meant. Just call that number and ask for you.
Okay.
Okay.
Thank you, Dr. Ray. We appreciate your adherence to the rules and regs, and we look forward to obtaining further information at our meeting in July, hopefully. Okay?
Okay, thank you.
Thank you. That's all. Our next order of business is a request from Dr. Delphine Shannon. She's requesting an exception to the 75-mile rule. Is Dr. Shannon with us?
Yes. Hi. Excuse me. Hello. Good morning.
Good morning, Dr. Shannon. Could you tell us the nature of your request?
Yes. Thank you for the opportunity to bring my request in front of you all today. Along with me, I have 3 nurse practitioners. So I think one of them had a patient they had to attend to because I'm sorry, the scheduling with today. I think we had originally thought it was going to be yesterday. But in terms of my request, I have a wellness and aesthetics practice in Gulfport, Mississippi, and I am requesting the 75-mile exemption rule to for oversight of 3 nurse practitioners in New Albany, Mississippi. They have a aesthetics practice. They have a primary care / acute care and aesthetics practice, but they were wanting just me to oversee the aesthetics part of their practice. They have a different collaborator for the other part of the practice. And so we were actually coming before the board. Originally, I had asked in February to add on hormone therapy to it, hormone replacement therapy. Again, I have a wellness and aesthetics practice, so I have been practicing for years now with these different therapies. And the nurse practitioners, they had a previous, sorry, let me back up for a sec. I had already been overseeing them for aesthetics because it was approved by the board back in 2023 that I would oversee the aesthetics part of it. And then they had their other oversight doctor retired, and they changed to a different one. And the hormone therapy they were asking me to then oversee. And so when I brought that before Mr. Dalton, he realized that we had never come before the board for the 75-mile rule. Somehow that was, I guess, just there was an oversight, he said, on his part back in 2023. So now we're bringing that whole thing before the board now. I hope that makes sense.
Okay. Thank you, Dr. Shannon. So am I correct that you said that are you already collaborating with these particular nurse practitioners?
Yes, sir.
And how long have you been collaborating with these NPs?
Since October of 23.
And what has been the nature of your collaboration? Is it you? Was it for aesthetics only?
Yes, sir. Yes, sir.
Okay, okay, but not hormone therapy, or does that include hormone therapy?
It did not. We were trying to add that now since their other oversight doctor had retired and used to oversee it, and now their new oversight doctor doesn't practice that. And so they were requesting me if I could do this because I do practice and have training in it. And so they wanted to add that onto our collaboration.
Okay. Do we have any other questions from the committee? Dr. Owens?
Yes. Hi, Dr. Shannon.
Hi.
Michelle Owens. Can you just kind of give me a rundown of your background and your training, and what your practice consists of, your personal practice?
Yeah, sure. So I'm a general practitioner. I went to school at USC, University of Southern California, and graduated in 1999. I did my internship year at Kaiser in Oakland, California, and have been practicing here in Mississippi since 2003. And I have a practice now that since 2011, I've been doing obesity medicine and have evolved to include wellness with hormone optimization and just helping people to age healthily in terms of lifestyle, nutrition, exercise, sometimes nutritional supplements if that's appropriate for them, and then also medical aesthetics. So I have body contouring laser. We have another laser like laser hair removal and other skin resurfacing or skin rejuvenation, I should say, procedures. We also do intimate health procedures and PRP, and then also injectable aesthetics like Botox and dermal fillers.
And can you clarify a little bit? So when you say intimate health, I know what PRP is, but anything else outside of that?
Yes, we have. So we offer. We have a device called. It's a Zimmer extracorporeal shockwave therapy device, and it's used to treat erectile dysfunction, along with something called a P-shot, which is the PRP injection actually into the shaft of the penis. We also do. We have another device, which is a radio frequency microneedling device that is used for the face and body type of skin rejuvenation and for wrinkles and scarring and things like that. But it also has an application to be used intravaginally. And so we'll do vaginal rejuvenation with that. And also there's a O-shot that we offer, which is, again, PRP treatment to the female genital area.
And so so when you speak about the addition of hormone therapy, can you kind of expand on what the expected practice for these nurse practitioners is going to be? Because admittedly, you've been in practice for a long time, and these particular modalities were not necessarily available or widely used at that time. And so you've gone through training and education over the course of time to be able to do these procedures and to learn about them. So
yeah.
With respect to these individuals who are going to be collaborating with you to add this on, like what's their scope going to be? What are they going to be doing?
So they would be doing mostly pellet therapy, hormone pellet therapy, and they have been doing it for several years already under somebody else's oversight. So they had training previously already, and it's very similar to my practice with that in terms of the hormone pellets. I believe they may have a few really probably more like a handful of patients that do injectable hormone therapy, like testosterone replacement therapy, but mostly it's testosterone and estradiol pellet therapy with a pellet procedure.
And so to your knowledge, these nurse practitioners are not performing any of those other intimate health procedures that you mentioned that are part of your practice?
Correct.
Okay. I think that's all I have for now. Thank you.
Yes, thank you.
Thanks, Dr. Owens. Dr. Gibbons, do you have anything?
No, sir, no questions on my end.
Just for my own edification, I'm not familiar with the term PRP. Could you explain what that is?
Yes, sir. It's platelet rich plasma, and it's when we will draw someone's blood. So we draw the patient's blood and then spin it down with a special centrifuge that will concentrate the platelets and the healing factors of blood into a smaller quantity. So like say if we withdrew 30 mils or 60 mils, typically it's 30 mils for the face, and then it will spin down into about 6 to 7 mils of the actually platelet-rich plasma, and that will help to promote healing, basically, with like what we say micro injuries. So a lot of times, like microneedling devices will have their effect in working because in terms of skin rejuvenation, because they're creating little micro injuries in the skin that your body then will flood the area with healing factors and promote that, unlike we used to do in terms of collagen and elastin, unlike we do as older adults, but what we used to do when we were younger. So the PRP just helps to accelerate that process and improve fine lines, wrinkles, some scarring from acne, things like that. And it's just oftentimes with microneedling, you'll just take the resultant PRP fluid that you got and just rub it over the skin, and then that the channels that you've created will then absorb it so that it has a better effect than just microneedling that's often done with like a serum, some sort of protein serum.
Thank you for that explanation.
Sure.
I'd like to hear from one of the nurse practitioners, Ms. Harrison. Do you have anything to add? I'm sorry, you're on mute.
Yes, sir. I just want to thank y'all for taking the time to listen to our request this morning. As Dr. Shannon said, we have already been performing those services with a different.
I'm sorry, could you explain to me again the nature of the services that you provide?
Yes, sir. So we do aesthetic medicine, so Botox, filler. We are also doing hormone replacement therapy. Just to give you a little bit of my background, I've been a nurse practitioner, a nurse since 2001 and an NP since 2006. I've been practicing aesthetics for 10 years and hormone replacement therapy for about 5. We are changing collaborators because our previous collaborator retired.
And he was your previous collaborator there on site with you?
He was not.
Okay. Okay, well, thank you for that. When you say hormone replacement therapy, could you tell me a little bit more about that?
So hormone optimization. So we're checking testosterone, estrogen levels, and getting those patients to an optimal range for wellness.
Okay. Well, thank you very much, Ms. Harrison. Ms. Boyd, do you have anything that you would like to add?
Yes, sir. Thank y'all for giving us a chance to speak. Basically, what we do with the hormone stuff is pellets, some injections. We do, just to clarify, we don't do any of the vaginal rejuvenation, the P shot, the O shot, those types of things at our clinic. So basically what we were trying to get approved for, she's been covering our aesthetics as far as our injections, our Botox, our fillers. She's already been collaborating with us on those. We're simply wanting her to take over our hormone portion of our practice too, because she is actively doing that in her practice and is a great resource and a great collaboration source for us and our patients moving forward.
Well, thank you, Ms. Boyd. Dr. Owens?
Thank you so much for that clarification, Ms. Boyd. Respectfully, we ask questions of the licensees. So we have a full understanding of not only what their scope of practice is, but also kind of what their understanding is compared to, you know, as it relates to the documentation that's been submitted. So
yes, ma'am.
We're asking those questions. I appreciate you making that clarification point. But I think we felt pretty clear about what it was that you were asking.
Okay.
We still may ask some questions that may seem unrelated, but are still meaningful to the executive committee.
Thank you, Dr. Owens. Any further questions from Dr. Givens or Dr. Owens?
Nope.
If there's no, do we have any further discussion? If not, we can entertain a motion at this time. Do we have a motion? I'm sorry.
Motion to approve.
We have a motion to approve. Do we have a second? We do not have a second. Oh, we do have a second. We have a motion and a second. Is there any further discussion or debate? If not, all in favor of the motion to approve, say aye.
Aye.
Aye. The request is approved, Dr. Ray, and thank you for your work. I'm sorry, Dr. Shannon.
Okay, thank you. Thank you, sir. Thank you all for the opportunity to meet with you this morning and to explain our request. Appreciate it very much.
Yeah, you're welcome.
Thank you. Okay, we can all leave the meeting then?
Yes, doctor.
Thank you, sir.
Yeah, that's all for you. Thank
you.
Our next order of business is a request from Dr. Selika Sweet. It's a request for an exception to the 20, 80, and 75-mile rules. Dr. Sweet, are you with us? There you are.
Good morning, and thank you for meeting with me today. I'm requesting consideration for a waiver of the 80-20 requirement and distance limitation related to my collaborative relationship with nurse practitioners practicing throughout Mississippi. Although I currently practice in Tuscaloosa, Alabama, my permanent residence has been in Pearl, Mississippi for over 30 years, and I was born and raised in Jackson, Mississippi. Mississippi is my home, and I remain personally and professionally committed to serving the healthcare needs of Mississippi patients and communities. Healthcare delivery has evolved significantly, particularly with the expansion of Medicare Advantage programs. Currently, near 50% of Medicare beneficiaries are enrolled in Medicare Advantage plans, which depend heavily on coordinated provider networks, interdisciplinary collaboration, quality oversight, and community-based care models. The collaborative work I'm requesting approval to continue is essentially the same type of physician oversight, quality management, interdisciplinary coordination, and medical complex patient care that I previously performed successfully with Molina Healthcare and Matrix Medical Network. I am presently working as medical officer on duty in a shift-based clinical role, typically working 7A to 7P medically covering at the VA hospital. My scheduling, it allows me to schedule as I want, as long as it's 40 hours a week. I work as medical officer on duty at a Tier 3 VA. What that means is that you have 3 levels. You have 1, 2, 3. The Jackson VA, the Houston VA, those are big hospitals with an emergency room. The VA in Tuscaloosa is a level 3. There is no emergency room. There is no ACLS, there's BLS. There's me, a nurse, a psychiatrist, a police officer. If someone is traveling from, let's say, Atlanta to Jackson and they have an emergency, then I am part of a team that for the most part will transfer them to the hospital. They see the word VA and they think that the veterans can get care there. I enjoy this job. I have worked emergency rooms for 30 years. This is similar, but is not as stressful. And it's perfect for a family physician, which is what I am. I'm a board certified family doctor. I would like to continue this job. My mother is 94 years old. I am her caretaker, along with my sister and brother. And this allows me to schedule my own duties for work and allow me to care for her on the weekends and so forth. I have previously worked with Dr. Tom Joyner in health systems, and Dr. Joyner was also over Melina as the director. This job is the exact same job that I was doing before. Melina and Matrix ended their contract due to reorganization. So I am presently not precepting any nurse practitioners. Fusion now has the same, there's no prescribing, there's no treatment, it's mainly chart review. I enjoyed doing this previously because it kept me in contact with Mississippi healthcare, and I got to know a lot of the nurse practitioners. Previously, when I had the job, I met with the nurse practitioners monthly, and I actually knew them, a lot of them, due to my 30 years of experience of being a board certified physician in Mississippi. I have worked from North Mississippi to South Mississippi in emergency rooms, and I know a lot of the healthcare providers in the state. So I am asking if you would please allow me to continue what I have been doing. I have spoken with Mr. Dalton, and he, when I was doing it with Melina and Matrix, I said, Mr. Dalton, this is the exact same thing as I was doing before. And he encouraged me to continue doing it and to meet with the board and ask your permission officially.
Thank you, Dr. Sweet. So am I understanding that you're requesting to collaborate with a number of nurse practitioners who are doing chart reviews for Medicaid?
It's Medicare Advantage.
Medicare Advantage.
Medicare now, 50% of Medicare recipients are now Medicare Advantage. And I also, at the VA, I cover a community living center, which is basically a nursing home. So I now have a lot of experience with advanced aged veterans. And so I have patients that are over 65. So this is Medicare. Melina and Matrix was Medicaid.
But you're requesting exceptions to collaborate with nurse practitioners around the state who are doing chart reviews?
They're doing health assessments.
Health assessments. So they're seeing patients.
They're not treating them and they're not prescribing. It's mostly getting information in regards to their diabetes, hypertension, hyperlipidemia, the same as Melina and Matrix, their health assessments.
And what do they do with that information?
Well, they can make suggestions to their primary treatment team when they go in the home. They may notice that they might be at risk of cardiovascular disease, and they make suggestions.
Okay. Thank you, Dr. Sweet.
It's with Medicare Advantage, it's more like a HMO or PPO. So it's just part of a team that is treating the patients. And these people are going in the home, making assessments, which gives them another view of the patient's overall health condition.
And how many nurse practitioners are you proposing to collaborate with?
It's, it would be as many as suggested. It's kind of open right now. They have a special need between Jackson and the Mississippi Gulf Coast. So it's not determined, but I would take any suggestions by the board.
Okay. Do we have any other questions from the committee? Dr. Owens or Dr. Givens? Dr. Owens?
Yes. Hi, Dr. Sweet. Thanks for being with us. Do you have, so are the practitioners, so all the nurse practitioners that you'll be collaborating with are going to specifically be within Mississippi? Are you
Yes.
going to be doing this for other states? It's just specifically for collaboration within the state?
For right now, I'm presently only anticipate for right now the state of Mississippi.
Okay.
I would like to say with Medicare, you have Medicare A, Medicare B, and now you have Medicare C. And Medicare A is like hospital, and Medicare B is like your medical treatment, and Medicare C is like the Advantage HMO. So if you just get Medicare, that's when you go to the hospital and you say, Doc, I have my card, will you treat me? Or you go to your primary care provider. With these HMOs, they have a whole system now where they give you gym memberships. They have certain doctors that you go to. It's like HMO. And so now they have healthcare providers that will go in the home and also do assessments. So it's part of their plan of the 50% of people 65 and older and people who get disabled, they get Medicare. For instance, like my mother, she lives by herself. She would have someone that would go in her home, a nurse, and they make an assessment of the overall health condition and report back to the family, to the providers. And it actually could be very good, especially with the aging population of the country.
So, okay, so are these nurse practitioners, are they evaluating these patients in person, face to face, or by telehealth, or
100% of it is face to face.
100% face to face? And where will they see these patients?
In their homes.
They see them in their homes. And so you said that you did this same work with Molina before, is that correct?
I did healthcare assessments, which was Medicaid, but it was not Medicare. With Molina and with Matrix, and Dr. Joyner, who used to be on the board here, was the director.
And were you collaborating with nurse practitioners for that?
I did, and I did it for 4 years, and we had no problems. I met with them monthly. I enjoyed it. And every month, we would have a topic that we would review, like high blood pressure, diabetes, cardiovascular risk, hearing loss.
So you're familiar with the rules and regulations?
I am, and I love education, and I did a lot of education with them.
Okay.
Real quick.
Yes, Dr. Owens.
Because Dr. Sweet, I remember you have appeared before this board for the waiver for that at that time. Like, if I remember correctly, it was for that particular collaboration, but you did not come in person that time. It was via Zoom, and
Right.
yeah, okay.
Yes, it was during Katrina. I mean, not during Katrina.
Maybe COVID. Yeah.
And it was the exact same thing. Actually, I didn't think I had to come before when they asked me when I got the job, and I called Mr. Dalton. I got to know Mr. Dalton, and I said, am I supposed to come before the way? He said, yeah, I think you should. So this is the same thing.
Well, thank you. Thank you. Thank you, Dr. Sweet. Any further questions? Any further discussion or debate? If not, we can entertain a motion.
Move to approve.
We have a motion to approve this request. Do we have a second?
Second.
We have a motion and a second. Any further discussion? If not, all in favor, say aye.
Aye.
Aye. So Dr. Sweet, your request is granted for these exceptions. So keep up the good work, and thank you very much.
Thank you. Thank you.
The next item on our agenda is the Executive Director report. Dr. Cleveland?
Thank you for the opportunity. Same as a lot of what I almost always tell y'all, I feel like, is I continue to meet with the other health boards on a monthly basis, and that's really increased in frequency because of the joint investigations we do. We continue to meet with the professional health program on a monthly basis. In the past couple of months, I've met with 3 different licensees about regulatory compliance concerns and gone through that with them. Most recently, I was a speaker, a roundtable speaker at NADI, the National Association of Drug Diversion Investigators. I spoke to a local OBGYN group, Gensaic Society. Say it again.
That would be Gynesic.
Gynesic. Okay. Thank you. And Sunday morning at 7 a.m., if any of y'all are at CME in the Sand, I will be the sunrise speaker there. So,
Thank you, Dr. Cleveland. Is there any other business for the executive committee this morning? If not, this meeting is adjourned.